Dayna Pham is one of the 8 million people in the US and 125 million around the world who experience psoriasis. She's also, unfortunately, among the 1 in 3 people with psoriasis who develop PsA. As a medical student and an advocate for the National Psoriasis Foundation community, Dayna has gained a deep understanding of how to thrive despite this disease. In this video, we'll talk with Dayna about the early signs of psoriatic arthritis that she might have missed, and we'll discuss how to best prepare yourself to act as an advocate on your own behalf at your next dermatology appointment. Avoiding PsA might not be possible, but by catching the early signs and advocating for proper treatment, a person can dramatically improve their chances of avoiding permanent damage while better protecting their joints.
Hi everyone, I'm Dayna. I am a psoriatic disease patient living with moderate to severe plaque psoriasis as well as peripheral and axial psoriatic arthritis. I'm 25 years old. I'm from San Diego, but I currently am a second-year med student at the University of Chicago. At 25 years old, being diagnosed with all these things in my younger 20s, it's been really important for me to learn how to advocate for myself properly, finding the vocabulary to learn how to express my symptoms, looking into ways that I can push for better treatment and work with my doctors has been really helpful for me in navigating my disease.
Dayna, why does someone with psoriasis need to understand PsA?
When I was diagnosed with psoriatic arthritis, when I started developing symptoms for psoriatic arthritis, I was 24 years old and I was like, it could not be that. Like 24-year-old me developing a chronic debilitating physical condition could not be me. It was me. There's no quote unquote too young for psoriatic arthritis. I thought that I was too young for it, so then I started developing like body stiffness symptoms, back stiffness symptoms when I was 24 years old. I just kept being in denial that psoriatic arthritis was coming about, but it ended up being psoriatic arthritis, and being on treatment for it was the thing that helped me the most. But according to the National Psoriasis Foundation, psoriatic arthritis can impact around 1 in 3 people who live with psoriasis, and it could be disabling and incredibly painful. Unfortunately, people have a hard time getting a timely diagnosis. So then when I moved to Chicago to start medical school, that's when I started finding a rheumatologist to support me, but like that also delayed treatment more. It's like not only the patient wait list, the access to treatment, the access to a rheumatologist themselves, as well as like the knowledge that I have or didn't have to get me to the rheumatologist in the first place, because I was in denial and I didn't know that what I was experiencing was psoriatic arthritis. So I think that by taking a proactive role in our care, including like advocating for a treatment plan that gets your skin completely clear, we can improve the chances of getting an accurate diagnosis and adjusting treatment before the PsA or the psoriatic arthritis does lasting damage.
What should people with psoriasis be doing to monitor for PsA?
As Dr. Lewitt mentioned, there's this pest screening quiz available at psoriasis.org. We think that, or the National Psoriasis Foundation advocates that it should be taken every 6 months. But also, we should also be monitoring for things like scalp psoriasis, nail psoriasis, and spinal pain. Those are potential signs of PsA or risk factors for PsA, with the scalp psoriasis and the nail psoriasis. And show your doctors your nail and scalp, and be sure to mention any pain at all. It's essential to be treating psoriasis aggressively. But with today's best medications that are available, which are like highly safe and effective, and the medications keep the inflammation of psoriatic disease at bay, and it can work to help treat the symptoms of psoriatic arthritis as well and prevent it from getting worse. And when we as patients show up by doing our research, taking the screening quiz, and reviewing the treatment options, it makes it easier for dermatologists to help us get on a treatment that gets the skin clear. The goal for all of us should be no disease activity. At least that's the goal for me. And I feel like we deserve to have clear skin as well as minimal disease activity in our joints while we adhere to our treatments, both lowering our chances of PsA worsening and lowering the chances of other comorbidities as well.
How can someone with psoriasis advocate for themselves?
A lot of advocacy starts with preparation. So what I do is I have like a notes app called Pain Journal or like Symptom Diary, and I track my symptoms and monitor for the signs of PsA that I mentioned before. Shared my notes with my provider. You could do this during or ahead of your appointment. For me, I usually just do during because I forget to do ahead, but whatever floats your boat. I also like to be updated for myself because I'm curious about like which biologics, systemics, and other treatments my insurance provider will cover. And that's called a formulary so that I can discuss with my dermatologist and my rheumatologist as we make treatment decisions. And I'm also clear with my doctor. Like my goal is no disease activity and clear skin so I can hopefully avoid more comorbidities. And since I live with PsA as well, I also make sure my dermatologist is aware of what my rheumatologist is prescribing. And in my case, it's like a collaboration thing because my biologic treats both PsA and PsO. It's honestly your health team's job to keep you healthy. Like they work for you. So when you're clear about your goals and expectations, it encourages them to comply with the latest treatment guidelines from the NPF, the AAD, and the American College of Rheumatology, which are the gold standards of care.
Psoriatic arthritis is a chronic systemic disease that impacts about 1 in 3 people who live with psoriasis. For the tools and tips you need to best manage your psoriatic disease, visit psoriasis.org.